of the Affordable Housing and Community Equity Development Commission on March 27th. I'm going to call the meeting to order. The first order of business is the roll call. Elijah Harrod Blaine.
Here.
Karen Britton.
Here.
Carrie Bond.
Here.
Rich Halverson.
Here.
And I think that's all we'll have tonight. Next item of business is the approval of the minutes from February 27th. And I think you all received a copy of the minutes from Kimberly. It was a good description of what happened, and she hit the high points, I think, of the AI that was presented to us last time. So is there anyone to provide a motion to approve the minutes from February 27th?
So approved.
A
Seconded.
second? Is there a second?
Second.
All those in favor?
Aye.
Any opposed? Minutes from February 27th are approved. Okay, the next order of business is a discussion of the homeless policy and homeless activities here in Annapolis. And I've asked Elijah if he would cover this, as he's been working closely with them through his actual work that he does with the county or with ADS. So I've asked him to lead off this discussion and to cover the issues that I think we do need to discuss. So Elijah?
Great. Thanks, Nancy. So appreciate the opportunity to talk with you all tonight. Just for purposes of the record, I am speaking on behalf of myself as a private citizen and not on behalf of Arundel Community Development Services, where I do work as the assistant planning director. Having said that, obviously all of us are a part of this commission because we care deeply about housing affordability and issues that kind of roll off of that, such as homelessness. And we all bring our unique experiences to the table to bring us into focus on what some of the potential solutions might be. I think I'll just kind of ground myself, or ground rather ourselves, in a couple of kind of basic elements about homelessness in the overall county. And we are, as a county overall, beginning to see a disturbing trend that has been happening, but it's accelerating. And that is, we are back to kind of pre-pandemic levels of evictions, and we're actually exceeding those eviction rates. And this is coupled with the ongoing year after year compounding effect of the lack of supply of affordable housing, keeping up with the growing level of demand. So that those confluence of factors are continuing to exacerbate the overall housing affordability crisis. And that is in spite of a tremendous amount of resources being invested in housing, affordable housing, and in spite of a variety of tactics being recently put in place through ordinances passed by the county that seek to improve the ability to develop affordable housing and provides that financing that is needed. From a financing perspective, we have an enormous asset here in the county of the Affordable Housing Trust Fund, which recently in the last about year and a half received a big boost of dedicated revenue from an increase in the deed transfer tax for homes that are valued in excess of $1 million. As a result of that, the county is generating millions of dollars that is going into the Housing Trust Fund. Combined with the fact that there was an MPDU, a moderately priced dwelling unit ordinance passed by the county recently, which improves density bonuses and has requirements for affordability in multifamily housing that is, I believe, in excess of 10 units, and has kind of a tiered process going up on that. So we've got money and like the city, Anne Arundel County has also gone through a comprehensive rezoning or a comprehensive planning process to look at the zoning ordinances. And it is well understood by the county, as it is by the city, about the importance of looking at upzoning and in allowing for, not requiring, to be very specific, not requiring increased density, but in allowing for increased density. I think there are two main things that I would offer that we as a commission really consider. I think first and foremost, actually maybe three. Um, there are first and foremost, I think what we know is that the shelter that is available for families is not adequate. We do not have enough shelter beds on any given night. There is a wait list to get into shelters, and some shelters do not have as low barrier admission policies as others. Even though some of their programs might be low barrier, not all of their programs, and certainly not all of their beds are low barrier. And so consequently, for shelter with low barrier, we do not have in that kind of area of shelter beds. We are very limited, and we are limited in the overall just shelter capacity. Period. As we all know, there's kind of a tug and a pull between investing in shelter when those resources could be invested in housing. But I do think it's important that we acknowledge that there is that need for shelter, and that is increasing with also of the increased rate of evictions. And so we need shelter, we need prevention, we need rapid rehousing, we need more housing in general. That leads me to my second point. So kind of that first point would be that we kind of think about as a commission what we think members of the city council as well as the county council need to be educated about in terms of the need. And so I would offer one of those would be an increased need for shelter, low barrier shelter, and shelter overall. I think the other thing is speaking for, again, just my personal experience. I had the good fortune of being able to manage Virginia's emergency rental assistance program during the pandemic. And so that $1 billion that we managed obviously was going to prevent evictions, but it was also used in somewhat of a rapid rehousing fashion as well. And that was because of the ability to do direct to tenant payments. And so I think there is substantial evidence at this point to demonstrate the effectiveness of direct to tenant payments, direct payments. We could call that a variety of things. We could call it a guaranteed basic income. We could call it a universal basic income. We could call it a direct to tenant payment. The bottom line is people can't afford housing because housing is expensive and they don't have the money to pay for it. If we can't build enough housing, then we need to give people the means to afford the housing that's out there. And what we do know through research is that when people with lower incomes are provided that additional money, they spend it on the things that they need. They don't need oversight. They don't want to be homeless. They don't want their children to be hungry, and they don't want their children to be without daycare while they have to go to work. Those are the three top things that we know that money gets spent on: housing, housing, food, and childcare. And so again, I would urge the commission to consider a education campaign around the need to support investments in overall affordable housing, while also pushing to the forefront the need for low barrier shelter and support for these direct payments to individuals. So that would be kind of the overall sum of kind of my thoughts on all of that.
So in Annapolis itself, we have the shelter is in Annapolis, correct? Or is it in the county?
So it is right on the city line.
border?
It
Yeah.
is
Okay.
quite
Cut in half.
literally, yeah, it is right
Lighthouse.
on the other side.
Yeah,
And for clarity, the shelter that you're referring to is the Lighthouse shelter.
right,
Of course, we also have Sarah's house up in the Fort Meade
which
area.
is up in the, right.
And then
I
we
was gonna
also have
ask,
the
I
Rundle
was gonna
House of
ask what
Hope.
other ones.
Yep, and that's up in Glen Burnie. Now that's not a shelter, that's a day center.
Yeah.
There's some shelters over there in Crownsville. I thought there was a woman's shelter over there. On
So
Crown.
there is Chrysalis House.
Right,
That
Chrysalis
is over
House.
in the Crownsville
Right, right.
complex. They are more focused on recovery support of
Recovery and
women
family
their
support.
family.
Yeah.
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 We talk about this a lot. Like in Winston-Salem, for example, we had like 6 shelters in the area. There was a family shelter, there was a men's shelter, there was a women's shelter, there was a low barrier shelter. Like to funnel everybody into one shelter is impossible. I mean, you say what you want about the Lighthouse shelter. I mean, you just can't manage that many people with thousands on that
How
wait
big
list
is
to get in.
Lighthouse? Is it the only one, Elijah, or is that the only one that's close to Annapolis? Is Lighthouse Shelter apparently is the only one in the city of Annapolis?
Yeah, it
correct?
is.
General admission
to
shelter.
both of those questions is yes.
Yeah.
Yes, it
Do
is
we
the only
know-
one in Annapolis, and yes, it is the only one.
Do you
Sir.
have any statistical data, even off the top of your head, as to, how many homeless people we have within the city limits? Or I'll say in and around, including that Anne Arundel County piece over there.
Yeah.
Okay, so since you provide that kind of supplemental
Caveat,
context
yeah.
to your question, what I can say is that the point in time count for 2024 was 250, but we know that's an
250
undercount.
people?
We know
Yeah.
that's an undercount,
For sure.
right?
Yeah.
Okay.
And
But
so
that's what you could get a count of.
that's right.
Like
And
that.
so I think there's a couple of factors to kind of think about that.
Elijah,
Right?
could I just ask you, what's that 250 number is for the county,
That's correct.
the whole county?
That's correct.
Okay.
Not including Annapolis.
That does
Yeah,
count
it does
because
include
Annapolis is part of the
Annapolis.
county for the purposes.
Yeah, that
of the
number is hard to
time
believe.
Right,
count.
well, it is. You're
Right, because
Elijah.
Slow,
the
right?
city does not get homeless funds. We get everything through ACDS. Anything that we have for homeless
Okay.
activities in the city
Mhm.
go through ACDS. Isn't that right? Or through the state?
That's
Would you-
correct.
Well, the only thing
you
we
get money
Well,
from the
I mean,
state.
CDBG, right?
Yeah,
Right,
so what
yeah.
That's the
CDBG, right?
exception. And so you
Yeah.
got your public service dollars
And
outside.
how many does the Lighthouse serve? How many can they house?
That's
Karen,
a good
Karen
question.
might know.
Yeah.
No, I used to work
Do you
there and I
remember?
should
I know
know,
it's in
but I don't.
recesses of your mind, but do you remember?
No, but I mean, there's 3 or 4 family units upstairs.
Okay.
And then I want to say maybe 50 or 60 total. I hate saying this on YouTube. I'm probably getting it wrong. And I could probably just reach out to my
It's
friend
a
that works there.
guesstimate. Karen, it's just a guesstimate.
It's
So
a
we can
guesstimate.
kind of put the numbers together. So
Yeah.
we need
But the
like-
good news is that so the Lighthouse Shelter had these properties around town that they would rent out cheap, affordable. They bought them in the 80s, early 90s. So one of them just sold for a huge profit. And they bought the 2 houses behind the Lighthouse Shelter. So I
Ah.
think that's how their thought is that they're going to break it up so that they can take more people because they've gotten very strict. I went the other day and, there's a police officer at the door checking and we
The,
said,
the published numbers are 45 individuals and 4 families.
45 and 4. Okay.
thank you.
So yeah, and that's
See, Rick?
I've got
Okay.
a document in front of me, and that
That's
it
so
mirrors
close.
exactly what Rich just said. I was like scanning through.
Rich, sorry. Yeah. Thank you, Rich.
Okay. And we don't, and do we know what kind of turnover there is? Or is there is a limit on how long they can stay, correct?
3
There
months.
is.
3
There
months,
is.
okay.
And I can also say, just like for example, Sarah's house, it's about
That is very
66
few.
people per night.
66? Wow.
Yeah, and
Bigger
so
than I
when
remembered.
when you kind of combine all of that together, you're seeing that we're getting to the like not even 120-ish,
Yeah.
Yeah.
Uh-huh.
right? And then there's the total. And so there's the cycle kind of through, there's the additional inflow,
Mhm.
so that's kind of gives you the statistical kind of perspective on all of this that
Yeah.
I think obviously underscores the points that I was
So,
making.
100%.
what's in North County?
That's
So
what
in
I'm
That's
North
where-
County, there's a Rundle House of Hope, but they are a day center. They are not a shelter. They also have scattered site housing, and a couple of other programs, but they don't operate a shelter, like a traditional shelter. And so I think, Terry, that's like, I think the fact that you're immediately, your mind is seeing the geography,
Yeah.
right? And I think that's a part of it. We also are now having the Stanton Center provide some additional beds
Mhm.
during times of extreme weather,
Yeah. And
right?
you know what's hard with that too is I don't know if you know, but I'm at Rise and Shine Bakery now. We're workforce development. We take formerly homeless, incarcerated, domestic abuse victims, aging out of foster care, and teach them baking skills. Well, we have a guy who was in the Stanton Center and then it warmed up. So now he's on the streets. Like we provide transportation to get him there, but he's tired when he gets there. You know, he's exhausted. He's been sleeping wherever he can find a place to sleep. He's hungry. So it it's a bummer that they can't keep it open more often. If they can open it in the cold weather, why couldn't they extend it year
Yeah.
round?
And I think the concern about Crownsville is that Crownsville is relatively isolated.
It
I mean,
is.
it's not on a major bus route. I mean, you gotta,
Gotta get to the mall.
it's
Gotta
gonna
get
be
to the mall.
yeah, exactly. You gotta get
Yeah.
down General's
Mhm.
Highway for that 7-8 minutes that it's gonna take you to get that way when you're driving
Longer than
60
that.
miles an hour down
Yeah.
it
Yeah.
to get to
Yeah.
the mall, and then you might be starting to get in place,
I, Elijah, I just want to throw this in there. I believe that the homeless population in North County isn't being counted. So you saying you have 250 people here in where we're at. When you look at North County and what affects the neighborhood there's a lot more people out that aren't getting counted. So even though we're looking at 250, if we think about that area and what, it's a high traffic drug area, so you've got more homeless people out there along Patapsco. I don't know if that's Baltimore or not, but it rolls over into the northern part of the county, and the only place people can really afford to live, and I've said this before, is Brooklyn, and even Brooklyn's getting too high.
Right.
Mm.
There's
And
that
that's
huge encampment up there. And
So there's the city limit
right.
that then folds into Brooklyn.
Yeah,
South of Brooklyn is Brooklyn Park.
right,
South of Brooklyn Park is Glen Burnie. To then
right.
the west is Severn. And then you go south down into the Laurel, Maryland City,
Yeah.
area.
Mhm.
And all of those, Brooklyn Park, Severn, Glen Burnie, and now Maryland City, are the 4 areas that we have identified in our consolidated plan that I came and presented on a few months ago. Those are the 4 areas now. It used to be 3: Brooklyn Park, Severn, and Glen Burnie, and now we've added in Maryland City.
Can I ask a question? I'm sure because it's so hard to count the homeless that that national day count, we know it's a low count. Is there a multiplier that people kind of accept that even though we say there's 250, you should really multiply that by so much to get a better
1.5 or
understanding?
something, yeah.
There isn't a statistical kind of multiplier that's put into the point in time count, but what we do is use kind of the known relationships and the known areas that outreach workers who are a part of the overall continuum of care regularly visit in order to do that. I do think, though, just to kind of pull us back a hot second, that I recognize there's always an intense need and desire to really get as fine-tuned data as is possible. I would offer, though, that like ultimately it's not that the data's wrong and that's the problem. It might be undercounting it, but even
Yeah.
the current count is making the point. And I
Yeah.
guess
Right.
The
Yeah.
real concern that I have is that there is not a uniform expression of support for the programs that are operated by the county, by those on the council. And so that is, of course, a natural kind of thing to see is some level of dissent. But overall, on an issue that is as cross-cutting as this, no matter where you are in the county, I would like to think that with some education, we could try and encourage a more unified support of these programs that cut across. It's not just at ACDS, it's also at the Department of Social Services. It's
Mhm.
also at the Partnership for Children, Youth, and Families. It's also at the Food Bank. It's all of this stuff.
And we don't have a rapid housing program. The county hasn't come up with one because I really believe that they're the focal point because they're bigger and the
Yeah.
people cross over. Okay, but do they have, in any of their legislation that they pass, do they have any kind of rapid rehousing programs in Anne Arundel County?
So we
I don't
have a
think so.
variety of rapid rehousing programs in the county. The big one that we're using right now is our home ARP money. And that's gone to a variety of providers, one being the Y, another being Sarah's House, another being the Blessed in Tech Ministries, who is
Mm.
using their home ARP money to support their work at the Stanton Center. So while Blessed in Tech's is not around rapid rehousing, the Y's ARP money, the Sarah's House home ARP money, those are specifically designated as rapid
Rapid
rehab.
rehousing.
Yeah.
Yeah. So I think what's interesting too is rapid rehousing, housing first model has been such a model. But what I'm hearing from people that work in the community, it is just potentially a recipe for disaster because you're not providing those services to get people where they need to be before you throw them in housing by themselves. And I
Right.
talked to somebody else who's in a program. She's like, one, I'm worried that we're not going to get any more of this money, so I'm not counting on rapid rehousing. And two, I don't think it works for my clients. So maybe if we had better, like you're talking, Elisha's, if we had better shelter situations where we could really get people stable before we have to throw them out into housing, I think that's a
Right,
better
some
use
of
of
them don't
funds.
have that skill set, Karen. The
No.
reality is, people that are homeless and transitioning, you just can't throw them because they have to learn the skills of how to care for themselves
Sure.
and some, I've seen a little bit of that in my
Yeah.
lifetime. So
I will
Yeah.
And then they're
offer
by
just on
themselves.
that DHCD has recently modified their qualified allocation plan that guides the distribution of the tax credits. It to
they
be
threw
better
that in there, right?
with permanent supportive housing,
Right.
recognizing, I think, Karen, the exact point that you're making,
Yeah.
which
Yeah.
is, yes, we need housing, but the population that we need housing for doesn't need just housing.
Housing. They
They
need the
need
supportive
housing
services.
and those wraparound
Wraparound
services.
services.
Yeah.
And so that's, I think, an acknowledgement
Yeah.
at the state level that
Good.
they recognize that primary asset that the state has, the tax credits, should be more used in a
Right.
intentional manner to support
Mhm.
permanent supportive housing.
Yeah.
And it's
We did.
funny, Elijah, because they're just getting on board. But when I worked in DC, 4 or 5 years ago, they had already started those programs. So DC is kind of like a model to see how they work. And the supportive services were being wrapped around some of the communities they were building. And, was just kind of started out like maybe halfway into my time there. So I don't know how some of them turned out,
Well,
but
it's been
they've been
been
doing.
a
Go ahead, I'm
it's
sorry.
been
ma'am.
part of senior housing for quite some time. The notion
Oh.
of housing with supportive services, and I think learning from that, it's gone into
Well,
family housing and
they
other populations.
Yeah, they afforded senior housing in some of the developments to be handicapped, disabled, or elderly. And the population of the disabled and handicapped were people that
Well,
needed wraparound services. And in my
and they need different. They may need different services
right,
from just
absolutely.
seniors. Yeah.
Yeah, yeah. And so have they provided that in some of the elderly buildings?
Oh, absolutely. Absolutely.
Yeah, because
Um,
it's a hard population to help, but
mhm.
they deserve to be treated humanely and helped as much as we can help them. That's for
100%.
certain. Yeah, yeah.
So I think
Yeah.
just to like kind of put a very fine point on like this whole discussion is we're in budget season. We've got, and like I think we could talk for a long time
Mhm.
about the implications at the federal level and what that's going to mean.
Oh God, we'll be
But
here
at the end of
till
at the end of the conversation, we're going to be no closer to identifying something that we can control. And so for me, as I'm thinking about this new environment that we're operating in, it's focusing in a very intentional way on what are those things very specifically that we can control. And what we can control as a commission is any recommendations or actions that the city council should make and county council. I would offer that because in the regard of homelessness, the county's resources are applying to the city,
Mhm.
that then the city's structures, like this commission, have a role to play in as a voice for these needs. And as I mentioned earlier, there has not been a unified show of support in the past on this. And so I think it's really focusing on identifying who has not supported in the past and figuring out what we can do to get them to come alongside those that have supported it.
Yeah.
Elijah, quick question. With your understanding of the mechanisms at the county in particular, what 2 or 3 avenues of support from the city would be most impactful or achievable?
Great question.
Really appreciate that question, Rich.
Yeah.
I think
I'm like over here.
first and foremost, it would be an existing structure that could be used for shelter on either a seasonal basis or ideally an ongoing basis. Because we all know there are so few lots and just the development process, it would take us 7 years and that's if everything went smoothly,
But I have a question. The city, although it's half county, half city, the shelter we have was really Annapolis based. It was the churches that came together, a lot of
Right.
community faith. We hear a lot from the city council people about the fact, well, why not in the county? The county abuts the city. The county has more land than the city.
Yeah.
I actually think maybe we should be talking about in the region, the Annapolis region, finding a site in the county that could serve. Because I think the
wouldn't
city feels
disagree
like
with that.
What? I'm sorry.
I would not disagree with that. But that said, I do think unless the city initiates that conversation by identifying at a minimum the fact that they are willing to be a part of some solution, not pushing it to the county and saying, well, why aren't you all doing more on this?
Yeah.
Rather than saying, we feel like we could bring this to the table. We believe this is the need. What can we work with you, county, to do to address this? And so to be very specific, are there operating dollars that the city could bring to the table to help support a shelter somewhere else? Recognizing that shelter may not be in Annapolis. And in fact, Terry, to the point you've already previously made, may actually be located in the northern part of the county.
Yeah.
I don't know if the city would do that.
That's the sort. I don't think so. Right?
Because the thing is, it's not even a thing of do we want to? It's a limited budget. The city's already stretched, it doesn't have, one thing, maybe there's other things it could do, like provide, work with some of the organizations in Annapolis that provide services. Maybe they could provide services. Yes. Hello, Karen. There too. Maybe it's that collaboration,
Yeah.
sharing what resources we have in terms of programs and organizations that do things, and providing that to help support the shelter. But the county has a lot more resources than the city does in terms of operating dollars. I mean, I can't imagine. Especially now, we can't ignore the fact that we're probably going to be losing federal dollars. I mean,
Oh, for sure.
Everybody is though.
yeah.
Yeah.
Wow.
But I think you make a great point, because what we do is we take people, all these backgrounds, we teach them a work skill for 3 months, but it's also soft skills. It's also case management. It's also therapy. It's also, stress management. It's, all this stuff that we're taking that off of the shelter. So it would be nice if the shelter could just kind of focus on just being a shelter, so they don't have to worry about so much funding to provide all these services, and kind of like outsource it to organizations like ours.
So I wonder if this is sort of different, but the fact is we got a big county. How many of these organizations, and I also look to the faith community. Everybody looks to the faith community, but how, maybe it's, and you guys are much more in the trenches than I am. I'm just thinking off the top of my head. But is there true collaboration among the different groups, and even expanding that to other groups, to provide the support and maybe the impetus for a new shelter mid part of the county somewhere, that can serve more people? I don't know.
We do. I'm so sorry. I'll just say this really quick. We get a lot of people from around here, but the only place we could find to bake or teach is in Odenton in this Masonic Lodge. So we have a driver that goes and picks everybody up and brings them up there and drops them all back off. But that's an affordable place, I would think, for shelters, programs, stuff like that, other than the city. So yeah, you're right. Sorry, Denise, you go ahead.
Oh, no, I wasn't. I'm just listening to everybody's ideas, and it just, gives me all of these thoughts. I was sitting here and, I'm like, look at Molly Station Mall. The place is empty. Convert it into a nice shelter town,
That's a very good point.
I'm sitting here and I'm saying, when you start talking about finding a building or finding a place, right? You've got all of the square footage, half of it's already cut up. It's got places where you can cook. It would be like a shelter town.
Well, that might be a bit, Denise, but
I know, but I was thinking big.
Shelter town.
It's gonna be front page on the news tomorrow. Denise recommended.
I'm already on cable TV talking about shelter town.
But I'm thinking
that would be like just amazing if something like that could happen, and it could really address. Heck, they can make little apartments in the mall.
So
when I was doing my housing project in North Carolina, I built it off of Loaves and Fishes. Tiny homes, teaching people skills. It's self-supportive, and I think it's a great model.
Yeah, it is.
So,
has anybody heard is there anybody taking over that mall? Are there any plans for the mall?
Right now, it's just kind of sitting with a Macy's and a JCPenney, and nothing on the inside of the mall.
JCPenney's not closing. Ours closed. Theirs is still open.
Ours is still open. And it's just because I'd hate to see them knock it down and build housing without considering the less fortunate population.
But that's the thing. There could be some incentives. The audio. I'm sorry. I better get off because my dogs are making too much noise.
Oh, it's so cute.
And a quick question, especially with all the ideas that centered around coordinating programs and coordinating with the county, who would be or is who would carry the water for the city, right? Our meeting frequency
Right now, nobody.
So is that a tangible step we could take to draft some notes and approach?
Well,
Alderman, go ahead, Elijah.
So it's the continuum of care. I mean, the continuum of care covers
Health
covers.
and Human Services Committee should be something that we could bring in because they address those, well, they address housing issues, so that's part of shelters,
Well,
part of housing.
they address both sides,
Right.
health and human services, I
So
mean,
maybe
housing and
they
human
should be-
services, so.
Yeah,
But at this moment, we've got a few things to contend with. One is the obvious strains on the budget that may be even greater
yeah.
in the immediate future. And secondly, we've got elections coming up, and that's gonna mean
That's change
that's
too. Yeah.
yeah, that's kind of looming out there. Yeah, but I do think that the commission as an entity we could put our thoughts together on how we would like to collaborate with the county, who has the real responsibility for the continuum of care and for homelessness. So we could figure out a way to work more closely with them on the continuum of care, even though we don't have the dollars at this moment to put in. And maybe the commission could figure out a way to put that together and
Propose it.
approach the council and the mayor currently and
Can I,
some of our thoughts.
let me ask, that 250 count, how much of it was in Annapolis?
I don't
Or
think Elisha knows.
Sure about that.
Yeah, I don't think we
You know,
know.
you need data to support trying to get the city to be a
To
big
do
piece
anything.
of this.
Mhm.
And, you know, I mean,
Yeah,
as I said earlier, we have a shelter. We're doing our part. We put this towards that. I mean,
Well, but
really is
to
that
be
larger.
very specific,
Mhm.
I mean, how much does the city support the lighthouse?
Well, we give them block grant monies. We actually
well,
do.
we have in the
How
past.
much?
We
I
have
don't
in the
know.
past.
But we don't have that much to give out. I mean, it's
I
not.
know,
That's not I'm not denying that.
Yeah.
What I'm trying to elevate is, the lighthouse is predominantly driven by private money.
Uh-huh.
Yeah,
Right.
right.
And so what I think the point I would offer is that outside of periodic public service grants to the lighthouse, what money controlled by the city of Annapolis is put into the issue of homelessness, and by extension, what is put into these activities that we have said are needed because of the level and type of homelessness that we are seeing, not only in the city, but also the county. And I
Yep.
think what we will find when we answer that question is that it is a relatively nominal amount, even when looked in proportion to the number of people experiencing homelessness, in proportion to the rest of the county.
So
And
I
I
don't
think
understand.
that's the overall kind of
What do you-
spirit
what-
that I think you might hear from the continuum of care, is that there is not this presence from a financial perspective that is needed. One
But we
last,
don't have the financial wherewithal in the city
so
to make those kinds of contributions. And I think that's what Terry is saying.
Yeah,
We just don't have it.
I think I mean, you're looking for money from the governmental entities. And, everybody complains about their taxes. Everybody complains about paying too much. And then we complain, schools aren't getting, I mean, everybody's looking for a piece of the pie. I'm just thinking the only way to maybe really improve those homeless services is a larger effort with the faith sector, with the nonprofit sector, and maybe some, and even foundations.
Yeah.
I think that it's limited how much, we use our block grant money, and that's probably going to go down. I mean, where's it going to come from when we're all competing for the same monies? I don't get it.
So I wonder about bonding. Like, is there some way that we could identify a funding source that could be paid on a bond? But putting that to the side for a second, I just want to come back to the whole Marley Station kind of thing.
Or-
I would offer that we are not likely the first people to think about that.
I'm sure that's true.
And I would maybe just let that sit.
What's happened? It's definitely out there.
It
People
just
are
came
aware of
across
that.
my mind as I was sitting here. I'm saying, where would be a good place to put a shelter?
Yeah. Oh, so you're saying people have thought about it and we're like, no thanks.
Here.
Then
I think
I didn't say that.
Oh.
yeah, but I mean, I've heard about that
We're all like,
notion for a while, actually. People have talked about what to do with Marley Station.
And
Sure,
I
but-
think the
but-
conversation is also now increasingly looking potentially at Annapolis,
For what? I'm
We're
sorry.
in Annapolis. There's
the
no,
Annapolis Mall area.
But Annapolis Mall has got a
They're
lot going on now.
revitalizing.
Yeah, yeah.
yeah, there's a
So
school.
my understanding is that between those two, there is a recognition that there is land that could potentially be used. I think, Nancy, the difference from previous conversations is that we now have more money in the county because of the Housing Trust Fund.
Yeah.
So what I'm thinking is that there could be redevelopment plans for Marley Station, and whether whether, and part of that could be incentive to put development on part of it and some public use on another part of it. A public-private
Right.
partnership.
Right.
Yeah, I don't think the mall the way it is now probably is that great for housing, but that site is, and there's a lot of
Line.
land there.
that mall is on a bus line and right at the highway.
Well,
Okay.
but that's the site. That's the site, Denise. I mean, you can use that site for this kind of
Yeah,
development.
yeah.
Just not necessarily that particular building, so, or maybe parts of it. I don't know.
It sure could have helped a whole lot of people who's been sitting empty, at least the Macy's
It's actually
building.
great. It's a great
or the Sears
location.
building, yeah.
Yeah.
You just,
So to get back to our initial discussion, though, is how could this commission play a role in planting a seed or for the future, really, on how the city and the county collaborate more closely on addressing the problems of homelessness?
Maybe it's just stating that, sending a letter, saying,
To
suggest
whom?
what the problem, well, to the city council. And maybe, I don't know, maybe now and after elections. I don't know. I mean,
I think, Terry, for me, that's kind of it, right? Is it as we as a commission ask the city to A, acknowledge this reality, and B, acknowledge the fact that there are known solutions that still need consensus around about pragmatically how to do it. And that if the city agrees with all of that, then there needs to be a very intentional conversation with the county around how to do that and what the city can bring to the table to help do that. It's one thing to say it, it's another thing to say what you're going to bring to the table to help address it. And I think that's the big thing that I think has been missing in the conversation.
and I think the Health and
Sorry,
Human
Rich.
Services Committee should be part of that, pushing that. The other thought I just got is we could tout, and I don't know if this is true or not, our success with the Lighthouse Shelter, how we worked with the community and the faith to support that. And I don't know if the zoning, I mean, I'm sure there was a lot the city did to help make that happen. Maybe not financially, but maybe a little bit financially. But that's the kind of the partnership, the collaboration, and focusing on the problem to find a solution.
Elijah, you act like the city takes up 50% of the county. It's only 11 square miles. And we don't have no, I was trying to just think of, any buildings in and around the city, and nothing comes to my mind. I know that there's not a whole lot of vacant land over there.
Yeah.
There's really what I see is there's nowhere to build in the city. And I don't know that there's any factories, old factory buildings that could be converted, because you know, my wheels are turning down the road.
Well, the other thing is that the comp plan that's just been, or whatever, I get consolidated plan and comp plan confused, but the city's new plan,
The
that's the way I'll just
consolidated
refer
plan,
to it.
yeah.
I mean, they have a huge discussion about multiple uses of various sites, and I
Mhm.
know from our discussions with Eric, they've looked at various currently underutilized sites or potential changes in
Zoning,
use
yeah.
of
That's a good
various
plan,
sites,
yeah.
et cetera. So, I mean, it's not that it's been out, but addressing homelessness has never really been part of their considerations, but providing affordable housing has been.
Right.
Right,
Um,
right.
And that's part of the solution too.
yeah,
The
yeah,
solution, too.
Yeah.
yeah,
other thing-
obviously, because
Remember
the
the
homeless
YMCA
population is
buildings?
out of the shelter in 3 months. I mean,
There's got to be a place for those folks to go. The other
Yeah,
thing is
yeah.
there's not a lot. One of the things, and it may have been because of development proposed on West Street, there's not a lot of industrial zoning in the city.
no.
And so
No,
it's
but-
not like we need to use that for, that kind of use and not change, it's the commercial.
Thanks,
It's
sweetie.
the over commercialized. That land has more potential, I think, for housing than our industrial areas.
Yeah,
So Elijah, I know that you are not busy at all, and therefore, I would suggest and hope that you could sort of draft something for us to send to I think the best shot is the city council committee, health, whatever they're called, housing and human, whatever they're called,
Health and Human Services, I think.
Health and Human Services Committee. Maybe that's our first point of contact, because at this point, I mean, I wouldn't suggest writing to the mayor at this point, because he's
yeah,
the
well,
lame duck at them, and I'm sure he's not going to be necessarily interested. The other thing, obviously, we'll have to watch what goes on coming up for the election, but that would be kind of maybe a first step.
I think the
Would you
first
be
step
cool?
is to kind of coordinate the ideas of everything that we've talked about here.
Well,
And,
yeah, I mean, that's what I'm hoping, that Elijah can kind of put together some of our thoughts and ideas, because I know he has nothing to do.
I can work with you on that, Elijah, if you are able to carve out some time on that. And I think part of this, in addition to the ideas that we've been discussing, was to be a little forward-looking. I think we've mentioned a couple times about potential reduction in federal funding or shifts in programs. I think that there's also some macroeconomic trends that suggest increased economic pressure on a greater percentage of the population. And I think if we all just took a quick straw poll, do we expect there to be more unhoused folks next year than there are this year?
I would say yes.
Likely, right? So at least discussing with them, not the hard numbers, but what are they going to commit to measure, to begin to monitor for signs that the solutions in place are reaching a breaking point, or kind of what can we at least map out in terms of how we continue to monitor the problem so that we can more quickly corral support for interventions in the future should they become necessary.
That's a great point, Rich. It's
yeah.
Good stuff.
So,
Thanks, Rich.
Rich, I appreciate the offer to work with me on that. I will definitely take you up on that. I've got your email. Draft something up and bounce it over to Nancy to take a look. And on just a letter to kind of the Health and Human Services Committee, trying to get them to maybe then co-sign on another letter that would go to like the council maybe or something like that.
Right.
So
I do think they would be our best advocates,
Mhm.
because I also think that there'll be continuity there. The three members of that committee will probably, in all likelihood, I don't think Brooks got, I don't know that they assigned him. He was looking to get the new legislative seat, or the legislative seat to replace Shanika?
Shanika
Yeah.
Henderson.
Shanika. I don't think he got it, or
He didn't
I don't
get it.
know. Have they
No, he
decided
didn't.
that yet?
I do, no, I don't believe he did.
I don't believe he did either.
So there'll be, he said if he didn't get that, he would continue on as a councilman. So that, and we know that, although we don't know about Dewan, I don't know. I mean, we've heard rumors about him for so long. I'm not sure, but there'll be continuity there, and regardless of what happens, not regardless of, it's likely not to change with the election in November.
Mm.
So if we could get some of them, if we could get them to be interested in thinking about this and thinking about the future, that would be helpful, I think.
I'd like
I
to
did-
get ideas, what are their ideas? What are they thinking?
Yeah, well,
What the heck?
yeah, yeah.
I do think also, like, I recognize we've got a limited pot of public service dollars, but
Well, and I think as Denise is going to tell us, we're not going to use them for public service. We're not going to be using them this year, public services.
are they all going to go to capital?
This year, yes,
Yeah,
definitely. But they did offer, I want to say another pot of money, but don't ask me to name that pot of money where they could have applied on the city side,
Maybe.
through other programs that don't really come through me, to get money for services.
And that was
ESPG.
something Teresa had actually been saying should be what we do. So
Right, and so I can't, there was, because Teresa's been working with us, and
Right.
it was one of the things that, when that decision was made, that there is some other money within the city, and they were directed to apply there. So how many applied, I don't know, because that's not money that I have anything to
Have
do.
any control over. Yeah.
Right.
So why don't we, before we get into that, why don't we agree that Elijah and Rich are going to work on a letter to the committee, and we'll move on from there.
Yeah.
That sound good to everybody?
Yeah.
That sounds
Absolutely.
good. Just as a point of clarity on my part. So I had heard from a grantee about there not being public service dollars, and I wasn't aware of that. I didn't feel like, when was that decision made?
no, but the thing is, what Teresa has told me is the fact that now they have to apply. They always apply to this. It's city funding. It's money that I forget the source. They
Right.
always have to make 2 applications. And she says it's a waste of time. They could make 1 application to this other funding source and probably still get similar amounts of money, because we don't have a lot. We spread it thinly. So there just won't be the block grant's not a good source for that kind of money. That's what Teresa has felt for a long time.
Right.
Yeah, and the amounts were so small, and in any event that they would be getting from us, it's always been the same grantees year in and year out.
And the pots of the money
Pot is
itself
so small.
has gone down as well, as you
Right.
would
So-
agree. The-
So
the- So
I-
the
I-
city, I'm sorry, Nancy.
so I think that they decided that it made more sense, at least this year, to not give out any public services dollars
Well, no, they didn't decide not to give out public service dollars.
out
They
of
gave them the
CDBG, out of CDBG.
Right, out of CDBG, but they had the opportunity to apply through another program within the
Right.
city. Look at the look on Elijah's face after he found that out.
So I guess I got a couple of questions. One, I recognize it's been said a couple of times that folks aren't aware of what pot of money that is. So naturally, my question is, what pot of money is that?
I believe it
like-
might be CSBG, Community Services Block Grant.
So
I would
that would be
guess.
helpful. Denise, could Could a
I will-
request from
I
the
will tell
commission
you-
be for information about what that funding source?
Well,
I will
Elijah,
tell
you
you-
could email Teresa and she'll tell you.
Yeah.
Teresa knows it. It's her recommendation. Is that okay, Denise? I mean,
Yeah. Or Denise could, you could directly ask Teresa or Denise will
You'll
ask her
know
and
by
Denise will tell
tomorrow,
us.
whether it's Teresa or I, one of us will provide you with the information. I just cannot recall right now. I was in a meeting today. We talked about it. I just cannot recall the pot of money. I don't know if it's the trust fund. And so,
Let them know, Val. There's a lot of alphabet soup with this stuff that I get, so totally get
Yeah,
that.
I
Appreciate any
think it might
additional
be the
information.
community services block grant money.
So that
but
would be
I don't know.
helpful to know. That would be helpful to know. And then I guess I'm just going to be the guy in the room that says it. Who is the they that made the decision? They made the decision. Who's
the
they?
city, the city, the people above me, Elijah,
So are we saying the council made this decision?
it was.
No, I don't think so.
Okay, so I guess that's where I'm starting to get lost because we've got Denise, we've got the council. There's only a few people.
Well,
in
there's Chris
between.
in between there. There's Chris. And it
I
may
would-
have been
I
on,
would say it was city management. That's how I'm gonna word it, and it involved multiple people.
and Elijah, to be fair, Teresa has talked about this before.
yeah, she has.
New.
She
and
has.
She's not, I really don't think she's trying to lessen the money that's available, although we are having less money, but it's the best way to serve these groups that have to serve all these applications and they only get a little bit here. And then she's oftentimes told people, well, we'll fund you this way instead of that way. So it's a
So
clean
in
system.
no way casting dispersions or questioning people's motives. That is not my intent
Good.
whatsoever. I know we're all here for the same good reasons. For me, it's just kind of a clarity of process to really then be able to be as much help as possible so that I can have my head in the same kind of line of thinking as everyone else so that I can be contributing as to the fullest extent I'm able. That's the sole reason for my questions.
Great.
But thank you.
Well, I would have provided you with that when we got to the CDBG part.
Just-
I would have given you that information because I have it all written here. I just don't know of the source of where they go to apply for funding, but I know it was on the government website. And I was trying to like jump off so I could give you an answer because you got me all stressed out, Elijah. Put me on the spot. No, but I just cannot recall at this particular moment where the source of that money is coming from.
Not a problem. Not a problem. I'm sure
But you
that's
will have your answer
that's a
at
findable
7:30
answer.
a.m. tomorrow.
Not a problem. If it happens Monday, Tuesday, Wednesday next week, that's fine too.
I was sounding right. Send Teresa an email right now. I'm blaming it on her. Teresa, they're yelling at me on the meeting. No, I'm just kidding. But they gave them an option, and the reason they did this is to slow down, because of the CDBG money and some of the points that were made here. And since we had another source of funds, we thought that it would be kind of like, I don't know what their thought was, because I just work there, so.
Understood. Thank you.
I know.
Okay,
that we were
so-
trying to simplify the process of giving out the same funding source.
Okay, so you guys, Elijah and Rich are gonna work on a letter. And we'll all take a look at it when the draft is there, and is that a cat or a dog?
The dog.
Oh, yeah, hello, little dog. So why don't we move on to Denise's report on where we are on CDBG?
Yeah, great.
Yeah,
And thank
right.
you.
You really want me
Before-
look,
Denise, wait,
Nancy.
Denise, wait a sec. Thank you, Elijah, for bringing this subject
Oh,
to
yeah.
our attention
Definitely.
and, trying to find a creative role for us to play in this, because I think we should be playing it.
It was a great
Um,
conversation.
Yeah. So thank
I
you.
have to say, I
You're
think,
welcome. Thank you all for the opportunity.
yeah, we talk a lot, but I feel like this is the closest conversation to yes, we're gonna get stuff done I think we've had in a while. That was a good one.
And I'm sorry to be negative about
Fingers
funding. It's
crossed.
just that I just,
Well,
No,
look, everything we
Mary,
do
thank
doesn't
you.
doesn't always have to be funding. We know we don't have it.
Yeah.
Right.
We
No,
know we
you're
don't
right.
have it.
You're right, Terry.
So, but, you know, what are we gonna do? We don't have it. And, you know, we don't even have, we're not gonna, we probably aren't gonna have the services dollars either, given what they're gonna do to HHS now, get rid of SAMHSA, you know, a few other
Ugh,
things.
Crazy.
Um, getting rid of all the experimentation of housing and supportive services that CMS was doing. They've gotten rid of that Office of Innovation for Medicaid dollars. That's the proposal that just came out today. So it's not looking
Yeah.
good.
It's not looking good.
But to the extent that we can do something, we should be trying.
Yep.
So thank you, Elijah.
I think we
Okay,
need,
Denise, your turn.
I'm scared.
Let's hear
to
where we
laugh
are on
now,
CDBG.
Nancy. I'm scared to even say anything about CDBG.
Don't be.
Elijah's getting me back from the last meeting. No, sorry, just kidding, Elijah. So as you now know, the city decided to do capital projects with the CDBG funds. And so we put we received 4 applications.
Let me interrupt for 1 second. Can you tell us exactly how much money we're gonna get or what you
I
think we're
haven't
gonna
gotten
get?
to that point, Nancy. It's on
Oh,
my piece of
okay, you
paper.
told, okey doke, I'll wait,
Hold on a minute. Hold
I'll
on.
wait.
Okay, thank you. So of course, did Teresa send you guys an email showing you where the applications were in the Google Drive?
Yes.
You got the email, okay. And you'll have like a month to review because we will pick up that on 4/24. We'll discuss the recommendations there at our next meeting, which I believe is April 24th. And we're still working on the consolidated plan and action plan with CDBG. And working with HUD. We don't know what the allocation is yet, so we're basing it on last year's budget. And we can't have a public meeting to discuss it until we get the official notification from HUD. So that's where we are. We're behind on this, and we're trying to play catch up now.
Do we have program income again, though? In the
No
amounts that we've
program-
had it before?
No program income this
No
year.
program income.
We
Okay, all right.
Lisa and I have been working on that budget, and that's what we've come up with. And she's made a couple of changes, and I don't really want to put it out there to try to put more money into the pot. For, last year we got 267,000.
Yeah,
And then we added program income, and we had probably last year maybe 10, 11 applicants there. And so that's all I have. So I hope I answered your questions, Miss Nancy.
so no program income, 4 applications,
For applications,
and we don't know yet the amount of money that we're gonna have.
we don't know what we're gonna get.
Okay. And do we think we're gonna know by our April meeting?
Not sure, certain. We're not
Yeah, I
certain.
wouldn't put any bets on a timeline. I guess the thing that I would offer, that I guess the way I'm thinking about it, is we are on a CR now.
Yeah, so
and
that money,
that's-
that's what we discussed today.
So, I
We
mean, the
should still
fact,
get the same money, but there's no guarantee of that.
right. It's more the distribution from the agency now more than an issue than it is of the appropriation from Congress.
Yeah,
Right. And there have been, and sometimes the appropriation doesn't really mean much right now, so
Right.
it could be problematic. We don't know what they're gonna do.
what they've already done, and you just look and see what's happening, and while we all stand by here and let it happen, because we
Now-
have to control.
That
So
said,
has-
inject a soupçon, if you will, of optimism.
Yeah.
The continuum of care programs are being honored.
Okay,
And so
good,
they are getting their money.
good.
Which
good.
is good. Right.
Um, has you guys that work with the Baltimore office, HUD office, have they been hit by cuts?
Not that I'm aware of, a couple of people retired that serviced us.
Okay.
So, Susan left, and then we have a girl named Ingrid, and then I think the financial person also left. Miss Diamond.
I believe Diamond is still there.
I thought I read something where she left.
Okay. There's another woman working in the you.
Well, the lady Ingrid that was assigned to us.
So Ingrid's still there. Ingrid reports to Paroma. We got my understanding is that there's a new field office
Yeah.
director.
Yep, Diamond sent an email on March 6th. I'm sorry, I pulled it up saying that she was leaving.
Oh, okay.
On March the 6th, she said that was her last day.
Oh,
Okay.
And it doesn't say that she was going anywhere else. And that's so she's definitely, I knew I read something, and Susan Taylor retired. So and we have a young lady by the name, I think, of Ingrid that took Susan Taylor's place. Susan Taylor's place.
all right. Because that could have an impact on how things get done as well. So, Murphy.
Internet to plan to impact how everything is done in this country. I'm sorry.
All righty. Well, thank you, Denise. So that sort of brings us up to date, and we know we're going to have discussion of that on the 24th of
Right.
April, when our next meeting is. So, is there any new business that we want to address? Anything that anyone wants to bring forward?
Do we have a new member?
No?
That person next to Nancy, that's not a new member of the commission?
Oh, yeah, but he doesn't talk, he just barks.
And he wants to be seen, so we'll just.
Yeah,
that's
he's
the
here
new
to,
business,
he's here to
voting.
contribute.
Yeah,
Rich, I'll be in touch in the coming week.
Okay.
All right. I
Do we
got
have
a daughter
a
that's
move to
screaming
adjourn?
upstairs. Thank you. Moved.
Second,
I'll second it.
all those in agreement?
Aye.
Aye.
Opposed?
Thank you all.
Okey dokey. I
Thank
have a
you,
dog to
Lisa.
deal
Thank
with.
you. Thank you.
Bye-bye.
Okay.